maybe they just had to put a new roof on their house that was unexpected and the budget just got blown.
Right. This comes from New Mexico. How do you recommend that I communicate with patients when I see that they have many issues in their mouth, but everything is asymptomatic and they don't seem to have any interest in proactively treating the issues I see?
So I'm going to use a phrase that I first heard from Dr. L.D. Pankey. Meet the patient where they are. Meet the patient where they are. What's the good news of this conversation? The good news of this conversation is they're there.
Right.
They're there. They're physically in your office, voting with their feet to be a patient. Now, unfortunately, they aren't motivated yet. Notice I just said the word yet.
Yeah, exactly.
They're just not motivated yet.
And maybe because they don't trust you yet,
Maybe.
So yeah.
And it could be something completely out. Maybe they have
Other
4
things
kids
going
in
on their
college
life.
right now.
Exactly.
Maybe they just had to put a new roof on their house that was unexpected and the budget just got blown. Right. So a good way to do that is to say, George, I completely understand. Here's what I would like to do. Clearly, both you and I can see there's issues here. We can both see that. Here's what I'd like to do. I would like to get you on a regular schedule of hygiene appointments. Now, while your teeth need some issues, the great news is your gums are nice and healthy. That means we'd like to see about every 6 months. Now, if we can see every 6 months in hygiene, we accomplish 2 things. We keep you as healthy as possible and we reduce your future expenses. Right. And I'll see you in those appointments and I'll keep an eye on things and I'll let you know what's going on and see if any of this gets to the point where we need to do something about it before it becomes a bigger problem. But that's a good way to proceed from here. George, does that sound reasonable to you? So all I'm asked to do is make a commitment to coming in every 6 months for their hygiene appointments.
Absolutely.
And Doc, thank you. Thanks for listening. Thanks for understanding.
Right.
Yeah. So get them committed, but let them know why, from the doctor, why I want to see every 6 months. Let them know why.
Right. I love the concept you taught us called the benefit statement. So
what's the benefit statement there? There's 2 reasons. One, it allows us to keep you as healthy as possible.
Right.
And then we reduce your future dental expenses because we can identify things at their earliest point and treat it when it's minor before it becomes something major. And then now knowing that he has other things in his mouth, we say, and I'll keep an eye on things to keep things from progressing to a point where it becomes really complicated.
Perfect.
George, does that sound fair? Yeah. It's a good way to handle that.